Welcome to this presentation on the manuscript entitled "The Inverse OARSI-OMERACT Criteria is a Valid Indicator of Clinical Worsening of Knee Osteoarthritis, Data from the Osteoarthritis Initiative." I'm Jeff Driban, Associate Professor of the Division of Rheumatology, Allergy, and Immunology at Tufts Medical Center. On behalf of my co-authors, it's a pleasure to discuss this paper with you. With the mandate to focus on patient-reported outcomes and individual-specific outcomes, there's a need to define clinically meaningful change in people. For example, the OARSI-OMERACT responder criteria is commonly used to define a clinically meaningful improvement in people with knee osteoarthritis. This criteria primarily relies on changes in WOMAC pain or function, which are commonly used in knee osteoarthritis clinical trials. If large changes are not observed, then we would also consider a patient's global assessment. While this responder criteria is commonly used to define clinically meaningful improvement, there remains no consensus on how to define meaningful worsening. One suggestion has been to use the inverse of the OARSI-OMERACT criteria, meaning using the same criteria, but rather than looking at improvement, we consider worsening. So for example, a person who may worsen more than 50% on their WOMAC pain or function and report an absolute change of at least 20 points out of 100 points on their pain or function scales would be considered to experience clinically meaningful worsening. If not, we would consider whether or not the person meets at least 2 out of 3 criteria that would require at least a 20% change and an absolute change of at least 10 points on a 100-point scale for pain, function, or global assessment. While this inverse OARSI-OMERACT criteria has been used in the past, it has not been validated. So the purpose of this study was to assess if the inverse OARSI-OMERACT criteria for clinical worsening over 2 years related to concurrent radiographic knee osteoarthritis progression, concurrent decline in walking speed, which is often prognostic of poor health outcomes, and future knee replacement. To achieve our goals, we did a knee-based analysis using data from the Osteoarthritis Initiative, which is a multi-center cohort study in the United States. We looked at knees that met the criteria for symptomatic knee OA at the 1-year visit. We defined symptomatic knee osteoarthritis as someone with a Kellgren-Lawrence grade of at least 1 out of 4 and a WOMAC pain score of at least 10 out of 100. We then used data from the 1 and 3-year visits to determine if the person met the knee met the inverse OARSI-OMERACT criteria. We then looked at 20-meter walking speed at each visit to determine if they experienced a meaningful decline in walking speed, which is considered at least 0.1 meter per second of change. We also examined radiographic progression by examining changes in Kellgren-Lawrence grade, which again can range from 0 to 4. We then looked at knee replacements over the subsequent 6 years. For these analyses, we looked at over 1,700 knees from about 1,300 people. Among the sample, 1 in 5 knees met the inverse OARSI-OMERACT criteria for worsening. The cohort was mostly female and white, and based on the average BMI, most participants were either overweight or obese. When we consider concurrent worsening, we find that individuals who meet the OARSI-OMERACT criteria for worsening were about 2 times more likely to experience concurrent worsening in radiographic severity and a decline in walking speed. Additionally, we find that individuals who meet the OARSI-OMERACT criteria for worsening are 2.5 times more likely to receive a future knee replacement than those who do not meet the criteria. Hence, the inverse OARSI-OMERACT criteria has good construct validity in relation to worsening of clinically relevant outcomes. We found that about 1 in 5 people meet the criteria, which is consistent with the literature suggesting that about 10 to 30% of individuals report clinically meaningful worsening over 2 years. The advantage, though, of using the inverse OARSI-OMERACT criteria over a single question or a single patient-reported outcome is that these criteria can take advantage and assess the multiple dimensions of clinical symptoms to truly explain the complexity of knee osteoarthritis symptoms. Thank you for your time, and we'd like to briefly acknowledge our funding sources. Thank you.